Hello and welcome to this session on understanding the paperwork that goes alongside moving and handling. Now, it's important that you understand the paperwork and you understand how decisions are made, because ultimately, as the carer, you're going to be the one following some of these principles and processes. It's also important to understand that family members may want to help, and actually, if family members are asking to help, you need to be sure that they're trained as well, and that you've seen the agreements for them to help you undertake the tasks. So be mindful that if a family member is offering to help you provide care, that you must make sure that they've had their inductions and that they've had the same training as you. So let's just walk through some of the paperwork and let's talk about why a patient may be a single call or a double up call, or indeed why somebody may go from a double up call down to a single call. Now, it isn't just because somebody's decided this is a better thing to do, and it's not because it's a cost-saving exercise. It is to do with promoting the independence of that individual and to provide continuity of care. So if we can get care down to a single person, then actually we can see more people, and it's as simple as that, really. So when we look at the paperwork, the first one we're going to look at is the assessment for informal care. And an informal carer is a member or a family member that's offered to help, and there's a risk assessment in which needs to be conducted. And it means that this person has gone through the same training and has the ability to perform the same tasks and understands the same duty of care as moving and handling as you, the carer, because ultimately they're sharing some of that responsibility in moving and handling tasks. Then we're going to have a single-handed assessment. So if you're not sure why this is a single-handed call, because you feel it should be a double-up call, look at the single-handed assessment, and in there it will explain why this is a single-handed call. Now, when they run through this, it's a simple checklist. However, it's not as simple as a checklist. They do use evidence-based decision-making. And those evidence-based decision-making comes from the risk assessments. And in the risk assessments, they use a couple of tools. They use the FIM score, which is the Functional Independent Measurement Score. And here you can see we look at the severity of what could go wrong to the likelihood, and it then comes up with a risk. Equally, what's important, the FIM score up here tells us how much the person must be able to do by themselves. So for example, if we're using a MoLift or if we're using other aids, it may say that you need a FIM score of 3 or more, meaning that the individual can carry out up to 75% of that task on their own. So they're able to lean, they're able to grab, they've got a good core and balance. Because if they have that, then the task should be a one-person task. But it doesn't end there. It is about how the carers are working, and for that we have what's called the Borg score, or the likely scale. But in the Borg score, we look at how easy or hard the task is. So if 2 people are doing the task and we say it's hard, then ultimately we need to review that care package, because it shouldn't. It should be fairly light. So in other words, the techniques, the machinery, the equipment should take away all of that stress. I'm not bending my back, I'm not lifting a load, I'm not pushing or pulling, because it's down to the technique and the equipment. So if 2 people do the task and it's hard, and we review the package and we bring in a hoist and we use the hoist to turn the patient, now all of a sudden, is that hard? And the answer is no, because you're not physically doing the job. The machine is doing the job. Therefore, the task is no longer hard. It should go down to a fairly light or very light. So when a package goes from a double up down to a single, it is assessed on the Borg scale. Is the task still fairly light or very light to do? And if the answer is yes, and it's safe to do, then the package will go down to a one-person package, because again, you don't need 2 people, because the machinery, the adaptations and the equipment have reduced that down to a safe level to work. Now, if however, after all of the machinery and all of the changes come in and you go, but it's still very hard, then that package can't be reduced, because the risk actually hasn't lowered. It's still the same level of risk. So ultimately, for us to reduce packages, to promote independence, We need to make sure that we have the right equipment and adaptations and the right moving and handling techniques. So in other words, has a thorough risk assessment been done of that individual, and have we prescribed the right techniques to lower that? So if we look back on some of the videos that we've already done, so for example, in a bed, if it takes 2 people to move them up and down the bed, is that necessary, or could we use a satin gliding sheet system with a wedge, and can the patient push themselves? Could we use a rope ladder either end of the bed? Could they use the rope ladder to pull themselves up or down? Why are the carers doing the work when there's machinery? So these are the adaptations, and these are the things we need to think about. Equally, moving and position somebody in a chair, if we use a sliding glove, and can we put the sliding glove in and push the knee and push the bum back into the chair? Does that technique work? Does it feel light? Does it feel safe? And if it does, then we can do that and reduce the need of using a hoist for that positioning technique. So it's about rethinking about the equipment, about the skills, and about the individual to promote their independence. Thanks for watching. Any problems, talk to your champion.